Thank you for joining us today. We value your time during this public health crisis. As we respond to the COVID-19 pandemic, UMMS is hosting these weekly webinars to ensure that you are fully up to date on our forward stance against the virus, as well as the steps that you can take to combat COVID-19 in your daily lives. And now it's my pleasure to present our presenters. First, UMMS President and CEO, Dr. Mohan Santa, and second, our System ICS Incident Commander, Dr. David Marcosi. They're going to be presenting on a variety of topics, including caring for our community, providing critical information on the importance of not delaying emergency care and how to stay healthy. Second, caring for our state, an overview on UMMS surge planning and our work alongside the state of Maryland in its recovery plan. We're also going to be answering your questions from last week's webinar on a number of topics, including symptoms and treatment. It is important to us that we hear from you as well, so please submit any additional questions that you may have during today's webinar using the chat feature to the right side of your computer screen. And you can do that at any point during the presentation. So before we dive into today's topics, Dr. Santa is going to provide us with a status update on COVID-19 in our state and system and share some other important resources. Dr. Santa.
So thanks, Chris, and thank you to all of you for joining us this week. We are honored that you continue to turn to the University of Maryland medical system as a trusted resource for information during this COVID-19 pandemic. We are also incredibly grateful to our communities for everything they've done to support our healthcare heroes during this time, whether that is cheering for our colleagues or providing donations of hand-sewn cloth masks to protect our healthcare workers, or simply by doing the single most important thing you can do to protect our workforce, and that is to respect the governor's stay-at-home orders and by practicing social distancing. Each of these gestures have been noticed and send a very clear message to the brave men and women who are here tending to the needs of our community in the healthcare setting, and it is so greatly appreciated. The medical center and system have also worked diligently to ensure that we are continuing to give back to all of the communities we serve across the entire state. So as schools remain closed, we are working to fulfill the nutritional needs of children throughout the state of Maryland, and we continue to plan and distribute more than 11,000 meals in the coming weeks to those who are in need. It's clear that over the last several months, all of us in Maryland have truly demonstrated what it means when we say that we are in this together. Governor Hogan has declared tomorrow Healthcare Heroes Day across the state. So buildings, including the State House and Camden Yards, will be lit in blue. And the Navy's Blue Angels and the Air Force's Thunderbirds will conduct a flyover as a well-deserved recognition for all the hard work of our healthcare staff. And I hope that you take a moment tomorrow to honor the sacrifices and the courage of those who are on the front line of this healthcare crisis. When we look at the global status update, in the United States, over 1 million people across our nation have been diagnosed with COVID-19. In the state of Maryland, 23,472 Marylanders have been diagnosed as COVID positive. Within the medical system today, we are caring for 315 patients across our health system who carry the COVID-19 diagnosis, and we have another 137 who are considered persons under investigation, and we are actively working to get them healthy. The COVID-19 virus has spread significantly throughout the state, but the action that we have taken as a collective community across the state has undoubtedly helped flatten this curve. So we want you to know that you can turn to the medical system as a trusted resource for information. And reach out to us if you have questions. The medical system has established a free nurse call hotline that is staffed by registered nurses that you can call anytime, day or night, to discuss your concerns or possible symptoms. The nurse call line is 1-888-713-0711. The CDC also has a COVID-19 self-checker tool on their website that you can also use to evaluate your symptoms. And you can find more ways, more tips on managing your health and wellness at UMMS.org/COVID. The state of Maryland has a free opt-in telephone service to check on Marylanders seniors age 65 and older. This is a program that is not specific to the state's COVID-19 response, but it can be an important resource, as social distancing likely means that your friends and loved ones cannot check in as often as they would otherwise like to do. So if you register for the Senior Call Check, you'll receive an automated telephone call every day. If you do not answer, someone that you choose will be notified so that they can check on you. Register online at aging.maryland.gov or by calling 1-866-502-0560. The first topic that I'd like to cover today is I want to address any concerns that exist within our communities regarding maintaining your health during COVID-19 pandemic. And I want all of those of you who can hear my voice to know that the medical system facilities, our healthcare facilities, remain safe and able and willing to deliver healthcare to non-COVID patients who are in need of urgent healthcare. We are actively protecting our patients by caring for patients with COVID-19 symptoms separately from those who do not have COVID-19. So when we hear that there are stay-at-home orders, I want to make sure that all who can hear my voice understand that this does not apply to patients who are experiencing symptoms of healthcare emergencies. Please do not delay necessary medical care. If you are having a healthcare emergency, call 911 or get to your local emergency room. Our emergency departments are open 24/7, and they are ready to treat you at your time of need. Never has and never will close our doors to anyone that is in need of help. If you are experiencing minor injury or illness, such as tooth pain or sprained ankle or general aches or pain, that may be appropriately treatable at an urgent care facility. And again, they remain open and able to take care of these needs. But if you are having chest pain, trouble breathing, high fever, if you're having symptoms that make you or loved ones worried about stroke, then please call 911 and get to an emergency room right away. We also have an ability as a health system to evaluate and deliver health care via telemedicine, which means you don't have to leave your home for a doctor's evaluation. Telemedicine can be for routine appointments, for wound evaluations, for medication refills or adjustments, or complaints or healthcare concerns that do not fall into the emergency category. It's important to all of us that you continue to keep yourself healthy, maximizing your healthy choices, establishing daily routines that include well-balanced meals and exercise and plenty of sleep. Make time for activities that you enjoy. Take all your medications as prescribed and stay in touch with your healthcare providers. Please do not ignore what your body is telling you. Warning signs and symptoms should be discussed with your doctor or evaluated at urgent care or emergency rooms, because we do not want our communities delaying care that can take a problem that is eminently treatable or a healthcare problem that left unaddressed, those circumstances could become worse very quickly, and that there is no need for that in this circumstance. We are here to address your health care needs. I'd also ask all of you to be mindful of your mental health during this time. This is an unprecedented health care challenge that is creating significant stress across our communities. And it is important to take care of your mental health while you're taking care of your physical health. The medical system is very proud to have hosted community webinars that we've titled that Not All Wounds Are Visible. It's a series that is focused on having open community conversations regarding mental health and the impact of COVID-19. These webinars help cover how you manage stress, how you help children cope with COVID-19, and how we stay connected with each other while social distancing. You can find all of these webinars at ums.org/notallwounds. I'm now going to turn it over to the Medical Systems Incident Commander, my friend and colleague, Dr. David Marcosi, who will give you a brief overview of the medical system surge planning and how we are working alongside and in partnership with the state of Maryland as the state defines its road to recovery. Dr. Marcosi and his colleague, Dr. Wilbur Chen, two members of the University of Maryland School of Medicine faculty, are privileged to currently serve on Governor Hogan's coronavirus response team. Dr. Marcosi, I'm going to turn it over to you.
Yeah, thanks, Dr. Santa, and good afternoon, everyone. It's always a pleasure and an honor to speak to you, and happy Friday. You know, we're working hard with our partners in public health and elected officials to make sure our state continues to position itself in the best, number one, response posture so we can address the health care needs of our folks in the state of Maryland, and also to make sure we're able to recover appropriately. And we're working lockstep with our public health and elected officials, such as Governor Hogan, to determine what that future looks like for our state. The state of Maryland is now moving from a position of containment and mitigation to recovery. And Governor Hogan released a responsible and safe plan forward for our state. And the plan's called Maryland Strong, Roadmap to Recovery. It has 4 components that must be in place before lifting any restrictions. 1 is expanded testing. 2 is increasing hospital surge capacity. 3 is enough personal protective equipment for our healthcare workforce. And 4 is effective contact tracing. We are proud to be working alongside Governor Hogan and his team to support every piece of those components, and notably, our efforts revolve around the increase to hospital surge capacity across all of our hospitals. The state has actually indicated that they are ahead of that schedule, and we expect to meet that goal of increased surge capacity by more than 6,700 beds. UMMS reopened as part of that hospital surge capacity University of Maryland Laurel Medical Center as an acute care facility in order to meet the increased demands of patients presenting as a result of COVID-related illness, and in partnership with the state of Maryland and that allowed us to open up that facility. In addition to that, as partnered with the state of Maryland and Johns Hopkins, UMMS worked with the colleagues at the Baltimore Convention Center to open up a 250-bed field hospital there for potentially patients who are recovering from COVID-related illness. UMMS will continue in its approaches to best ensure that our hospitals have enough space and staff and effective equipment to meet the demands of all of our patients presenting. And we actively are working to make sure that there are steps in place to address any community health concerns, and we meet the needs of our local and state health officials appropriately. Chris, back to you.
Thank you, Dr. Marcosi. Now we will turn to answering some of the questions that you asked us last week. As a reminder, you can ask questions at any point during today's webinar. There's a chat function on the right side of your screen that you can use to do that, and we will provide answers to every question on our UMMS.org website early next week. First question is for Dr. Santa. Is there any medicine that I can take to prevent or cure COVID-19?
So thanks for this question, Chris, and the simple answer is we do not have any medicine today that prevents COVID-19. We as an academic health system are proud to have been part of a recent study that received national attention regarding the identification of a new medicine to serve as an antiviral that has shown the ability to reduce the severity of the infection of COVID-19, but we need to be clear that these results are very early. But that is part of the benefit of being a large academic health system. So the single best thing that any of us can do is to continue to respect the recommendations of social distancing. And if and when you go out, wearing a mask to help decrease the risk of transmission of this virus. These are the important things we can do to actually help prevent the spread of disease. Again, I would say that if you have symptoms, please consult your physician if you have any questions and or concerns.
Thank you, Dr. Santa. Next question, also for you. How is UMMS helping advance research on COVID-19?
So again, as I just mentioned, we have a foundational partnership with the University of Maryland School of Medicine and the University of Maryland, Baltimore, and we are blessed to have world-class experts in parts of our organization within this university, such as the Center for Vaccine Development and Global Health, and the Institute of Human Virology, and the Institute of Genome Sciences, where researchers are working incredibly hard to find answers to several of the aspects of this pandemic. They are conducting clinical trials for new therapies, such as the one that I just described. They're coordinating with international colleagues around the creation of COVID-19 vaccine trials. And they are also ramping up their abilities to develop and produce high-capacity COVID-19 testing resources that hold promise for dramatically increasing the testing capacity of our state. In the laboratory setting, coronavirus epidemiologists and virologists are conducting a wide swath of testing for dozens of potential therapies.
Thank you, Dr. Santa. Next question, also for you. Is it okay to get a routine blood test at a lab at this time?
Absolutely. Our healthcare facilities are safe for patient care. So if you are in need of blood work and your physician has directed you to receive blood work, please do not hesitate to follow those orders.
Thanks. Next question, also for Dr. Santa. Does getting a flu shot protect against COVID-19 or help with symptoms?
So while there are no vaccines or immunizations right now to prevent COVID-19, this is something that we are actively working on, as I mentioned a minute ago. This is work that is going to be critically important as we begin to enter into next fall's flu season. And so it is very important for everybody, again, who is listening today to recognize the importance of getting a flu shot, because being able to prevent the flu is an equally important priority as we develop the ability to create a vaccine that will, in the future, help us prevent COVID-19. So if you're currently having symptoms that you think may be connected to COVID-19, please call your healthcare provider or call the medical system's nurse call line. Alternatively, if it is a healthcare emergency, please call 911.
Thank you, Dr. Santa. Next question, also for you. We hear much in the news about the importance of flattening the curve. Is that curve actually being flattened in Maryland?
Absolutely, the answer is yes, and that is a consequence of your efforts. The effort in the state of Maryland has been incredible. We're thankful that our leaders in the state, specifically the governor, took early action and demonstrated leadership in having our state enact non-pharmaceutical interventions or social distancing. And so practices such as social distancing, practices such as washing your hands, wearing a mask in public, these are all things that have dramatically impacted our ability to flatten the curve. And so again, when we talk about being in this together, we need to know that these efforts within our community are the very efforts that allow us as healthcare providers to meet the needs of patients who are coming to us.
Thank you, Dr. Santa. Dr. Marcosi, next question for you. When is the quarantine going to be over? Will Governor Hogan lift the stay-at-home order soon?
Thanks, Chris. You know, we talked about before that Governor Hogan released a roadmap to recovery recently that lays out specific goals and thresholds that must be met before lifting restrictions. And UMMS completely endorses that roadmap to recovery and thinks it's the right steps to put in place before our state can open up. We don't know now when the governor's stay-at-home order will be lifted. But when it is lifted, I just want to emphasize to all of us that that does not mean that this virus has gone away. And things we've talked about previously with regard to hand washing and keeping and cough and sneeze etiquette and keeping high-touch areas clean and making sure that we're socially or physically distancing, those all still must stay in place so that we can continue to limit the spread of this disease.
Thank you. Dr. Marcosi, next question also for you. I've had seasonal allergies for years. How do I tell the difference between those allergies and COVID-19 symptoms?
Yeah, mild COVID-19 symptoms can look very similar to a lot of other conditions, including seasonal allergies. Seasonal allergies and COVID-19 can look like, you know, a little bit of dry cough, some runny nose. COVID-19 symptoms can even have fever or a mild shortness of breath associated with it, which may not be necessarily the same as seasonal allergies. But if you consider your seasonal allergies may be the same as previous years, then it may not be a threshold of which you need to call your physician. But it's always better to err on the side of caution as you're feeling as though that your symptoms may be a little bit different than last year or may not necessarily be lasting a little longer than they typically do. Certainly give a call to your primary care physician and get evaluated. And if you are concerned, then certainly make thinking like you have potentially mild symptoms associated with COVID-19 and staying away from those that you may get ill as a result of having the virus. We need to make sure we put those practices in place. Chris?
Thank you. Our next question is for Dr. Santa. I am really stressed out about the virus and all of the pressures my family is facing. What's the best way to care for my mental health?
So thanks for this question, Chris, because throughout this crisis, we at the medical system have tried to continually communicate that we want to care for your entire health and well-being, including your mental health. And it's important, especially during this unprecedented time. You can find lots of resources on this topic at UMMS COVID response page at umms.org/COVID. We constantly have said that we want our communities to be prepared but to not panic, to create a contact list of important phone numbers within your own home, also to include community resources and other essentials in the event that you need to access them. Dr. Stephanie Knight, a phenomenal physician leader who is the chief of psychiatry at the University of Maryland Medical Center Midtown campus, suggests making sure that you have at least 2 conversations each day that aren't about COVID-19. Social distancing while staying connected with friends and family through calls, text, and video, because again, we continue to reiterate that social distancing should not mean social isolation. Self-care is important, so you need to continue to focus on eating healthy, exercising, and getting outside whenever possible.
Thank you. Dr. Sunt, the next question also for you. Can UMMS help connect me with additional resources on keeping my family safe and protected?
Absolutely. So again, I'm going to ask you, please visit our COVID-19 response page at umms.org/COVID for information on protecting against COVID-19 and managing your health and wellness. Because on this website, there's also information that deals with stress management, coping with financial stress, seeking help if you're a victim of abuse, or you need to report an abusive situation. These pages have links and phone numbers to connect you and your trust, and it is a trusted resource connection to such as 211 Maryland or the crisis hotlines that exist. We want to help. Do not hesitate to reach out.
Thank you. Dr. Marcosi, next question's for you. Should I be wearing a cloth mask?
Governor Hogan signed an executive order requiring face masks or coverings while riding public transportation or inside any retail establishment, including grocery stores. This is in alignment with CDC that everyone wear a mask or a homemade mask when in public. UMMS, our health system, has already adopted this stance, and inside every facility, so inside every hospital, you need to be wearing a mask. And that's in the interest of safety, and we're making sure that everyone who enters a hospital has the right protections in place to limit the spread of this virus. You can make a cloth mask at home using a bandana or an old T-shirt. You can find links to how to do that at umms.org/COVID. Wearing a cloth mask helps reduce the likelihood of transmission, but it does not replace physical distancing. So you need to effectively do both. Chris, back to you.
Thank you. We have time for one final question. Dr. Marcosi, it's for you. It's a follow-up question. How should I clean my cloth mask?
Yep, good question. So thoroughly washing your cloth mask with soap and water should destroy any virus. So that's what you need to do for your cloth mask. That's also what you need to do for your hands. Chris?
Thank you very much. And thank you to all of you for joining us today. We really hope that you will stay connected with us. You can find our social media channels displayed on the screen right now, and we hope that you will sign up for our health and wellness emails at umms.org/email. Wanted to also remind you about our COVID-19 response website, umms.org/COVID, as well as our nurse call line, which anyone in the community can call at any point 24/7. That number is 1-888-713-0711. We are grateful for everything you are doing to keep yourself, your loved ones, and your community safe. On behalf of Dr. Santa and Marcosi, thanks again for joining us today, and have a great weekend.